This is a story of a 74-year-old Filipina who is happily married, a Catholic, and was born and is currently living in Bacoor, Cavite. She came to the health center with a chief complaint of wound on her right leg. 1 week prior to consult, the patient was poked on the right leg with a stick by her grandson, causing the trauma site to be swollen and eventually bleed. The wound was cleansed with soap and water followed by application of betadine solution. The patient self-medicated with cloxacillin for 3 days, which afforded no relief. No prior consultation was done. Patient also complains of tingling sensation of fingers and numbness on toes. 5 days prior to consult, the swelling subsided but the patient still complains of pain on the wound side. 2 days prior to consult, there was discharge and redness on the wound side. There were no associated symptoms such as fever, chills, nausea and vomiting, or palpitations. Persistence of symptoms prompted consult in our health center. Let's get to know the patient more. Patient AO is a known diabetic for 14 years, maintained on metformin 500 mg and gliclazide 30 mg. She is also hypertensive, which is under the maintenance of losartan 50 mg. The patient delivered 4 term babies, all are normal and without complication. The eldest child was born through normal spontaneous delivery, while the other 3 was born via cesarean section at Philippine General Hospital. Patient AO lives with her husband, 2 sons, and her grandson. They live in a bungalow house which is well ventilated and well lighted. A long time ago, she worked in a garment factory for 15 years. She also worked as a street vendor, a maid, and a housekeeper. Upon physical exam, the pertinent findings are fine tremors, 6 by 9.5 centimeters wound on the right leg, and bilateral weakness on dorsalis pedis. On the other hand, there is adynamic precordium, normal rate regular rhythm of the heart, and no murmurs. Other system shows normal findings. Diagnosis: infected wound at the right leg, diabetes mellitus type 2 with diabetic neuropathy and controlled hypertension. Here is the family profile of patient AO. And now for the genogram. The patient's father died of stroke while her mom died of heart disease. The patient is the 4th child among 10 siblings, 2 of which are hypertensive and 2 are diabetic. One of her siblings died due to heart disease, and the other died of complications of diabetes. Having said this information, it is evident that there is a strong history of hypertension and diabetes within the family. The patient got married and had 4 children. All are alive and well, except for one who has cerebral palsy and the one who died due to meningitis. Her youngest son had a son who is alive and well. This is the presentation of the family map. The family lifeline. On the year 1964, the patient got married to BO at the age of 24. On the year 1967, patient had a daughter who died because of meningitis, who is 13 days old at that time. On the year 1971, her husband was diagnosed to have tuberculosis. On the year 2005, the patient was 60 years old at that time, who was diagnosed with diabetes mellitus. Year 2009, their family moved to a new residence in Vasquez, Bacoor, Cavite. Year 2010, J.O., her son, started his job as a construction worker. On the year 2016, her grandson, KFO, started going to school. The economic profile. The patient's family gets their monthly income roughly around 5,000 to 10,000 pesos from the contribution of the pension of the husband, the income of the youngest, and at times from the patient's eldest son. 3,000 pesos is allocated for the food of the family, while 200 pesos is for the water, which is basically the mineral water they're buying. 500 pesos is the estimated expense monthly for the electricity, and 1,250 pesos is for the maintenance medication of the members of the family. 500 pesos is for other expenses such as transportation, projects and school of their grandson, and an emergency fund, just in case. Environmental profile. The patient is living for 10 years in a bungalow type of house. There are 5 household members, and there are 2 dogs and 1 cat. Garbage collection is done daily in their village. Ito po ang kanino pong CR
Sa akin. Nilagay din ng mga lumang plywood, mamaya ayusin. Naayos kasi yung bahay ko.
The food preferences of the patient are the following: fruits, vegetables, fish, chicken, pork, junk foods, fast foods, and sweets. This is the family life cycle. First order change. Even though there is a limited income, they do not have any loans. Thus, they were able to work out financial matters. Also, tasks and responsibilities such as cleaning the house and taking care of each other was divided equally and willingly done by each family member. All the issues within the family were settled by maintaining an open line of communication. The family was able to talk about the issue and set a common ground to be agreed upon. Second order change, shifting of parent-child relationships, which includes behaviors, feelings, and expectations that are unique to the parent and to the child. This family was able to have this shifting of relationship by communicating to each other on what decision they're going to make that may affect themselves as well as the family. Problems encountered: lack of monetary savings. They do not have any savings for unexpected or emergency expenses. This is due to the reason that their monthly income is just enough for their daily survival. The family APGAR. Adaptation, almost always. Partnership, some of the time. Growth, some of the time. Affection, almost always. Resolve, almost always. The APGAR score results 8, which is highly functional. This is the SCREAM Family Resources Survey. The SCREAM Family Resources Survey scores 21, which is a moderately inadequate family resources. For the family care plan, here are the primary, secondary, and tertiary prevention.